So, hi guys. Medical negligence. Yeah, we're gonna see about today about medical negligence in forensic medicine. Okay. Medical negligence. Its synonyms are professional negligence, medical malpractice, medical malpractice. Definition: absence of reasonable degree of care and skill, or willful negligence of a medical practitioner in the treatment of a patient which results in injury or suffering or death of the patient. So again I repeat, absence of reasonable degree of care and skill, or willful negligence of a medical practitioner in the treatment of a patient which results in injury or suffering or death of the patient. Failing to do something which one is supposed to do, act of omission, or doing something which one is not supposed to do, act of commission. Okay, now coming to circumstances where act of commission omission are applied are negligence, euthanasia, and infanticide. The meaning for this is like this act of commission omission are applied in case of euthanasia, infanticide, and negligence. So these are the examples for negligence, examples for commission and omission. Mm. Elements of negligence. There are 4 D's, that is duty, dereliction of duty, damage, direct causation. We'll be seeing this in detail. That is duty, dereliction of duty, damage, direct causation. All the 4 elements should be proved to convict a doctor for medical negligence. Okay, that is duty, dereliction of duty, damage, and direct causation. First one is duty. The doctor owes a duty to the patient when he agrees to treat him, or in the above circumstances the doctor patient relationship is established. If the doctor did not agree to treat the patient, or when the patient does not need emergency care, doctor patient relationship is not formed. So yeah, let me explain. If the doctor did not agree to treat the patient, or when the patient does not need emergency care, doctor patient relationship is not formed. I think it's not clear. Okay, what kind of this is okay. Dereliction, disregard, recklessness, or carelessness during treatment. Failure on the part of the doctor to maintain proper care and skill. Okay. Now coming to the third element of negligence, that is damage. Damage caused as a result of dereliction. Dereliction is basically carelessness. The damage should be a type of that would have been foreseen or anticipated by a reasonable physician. So the damage should be somewhat common in case of like due to in case of like like the common damage which can be anticipated. Even if the doctor is negligent, or damage has not occurred, the patient cannot sue him for compensation. Even if the doctor is negligent, the damage has not occurred, the patient if the damage does not occur, the patient cannot sue him for compensation. Okay. Examples for damage: prolonging of illness, aggravation of illness, prolonged hospital stay, pain and suffering and death. Direct causation. Dereliction is the direct cause, proximate cause for damage injury. That is, failure to exercise reasonable care, skill, and was directly responsible for the damage. Failure to exercise reasonable care and skill was directly responsible for the damage caused. That is direct cause. You are not giving the treatment properly, so damage has occurred. That is called direct cause, direct causation. Okay. Types of negligence. So we have seen so far elements of negligence. Now we are coming to types of negligence. There are around 4 types, that is medical negligence, contributory negligence, composite negligence, and corporate negligence. Under medical negligence, we have civil negligence and criminal negligence. Coming to civil negligence, patient or relatives may charge against doctor for compensation, or the doctor may charge against the patient who refuses to pay fees alleging negligence. The doctor charge against the patient who refuses to pay, citing for doctor's negligence. Trial occurs in civil court or consumer court. Burden of proof on the patient, that is, patient must prove doctor's negligence. Okay, if proven guilty, the doctor need to pay compensation as decided by the court. If the patient proves the doctor's negligence, the doctor have to pay the compensation as decided by the court. Examples: failure to get informed consent, failure to give proper instruction, failure to warn the patient about side effects. So these are the examples of civil negligence. That is, failure to get informed consent, failure to give proper instruction, and failure to warn the patient about side effects. Now coming to criminal negligence. Gross absence of skill or care of the doctor during the treatment that resulted in serious injury or death of the patient. So better you study properly during MBBS days, or else you will find yourself in criminal negligence. Okay. When the doctor performs an illegal act, that is criminal abortion, undue delay in treatment of an assault victim that resulted in death. Okay, even delaying the treatment also comes under criminal negligence. Continuing criminal negligence. When the negligence of the doctor went beyond the matter of compensation. To be found guilty, that alleged negligence should be proved beyond reasonable doubt. If found guilty, the doctor need to pay compensation, that he may be sentenced to imprisonment. When death is caused due to negligence, punishment will be 2 years of imprisonment plus fine under the section of 304 S304 section 304A IPC. Let me write it. Section 304A IPC. So this is the section which gives imprisonment for 2 years plus fine. Okay. Now examples are amputation of wrong finger or wrong limb, leaving instruments or swabs inside the abdomen. There's a movie where a doctor puts helmet inside the abdomen. Performing criminal abortion. Now coming to contributory negligence. Both the doctor and the patient or his attendants are negligent. Without the negligence of the patient, the damage would not have occurred. Okay. The doctor prescribes drug, does not warn him about side effects. This is doctor negligent. Patient gets side effects, does not inform doctor. This is patient negligent. Suffers injury, contributory negligence. Okay. Now, now we'll see two scenarios. First scenario is last clear chance doctrine. Both the doctor and the patient are negligent. If it is proved that the doctor had a last clear chance to avoid the damage caused to the patient and he did not avail this chance, the doctor loses the defense of contributory negligence. So, if the doctor had the last chance to avoid the damage, then doctor will be sued and will be given punishment. Doctor prescribes a drug, so the scenario is doctor prescribes drugs to the patient, does not inform about its side effects, that is doctor negligent. Patient develops side effects but does not inform doctor, this is patient side negligent. Patient visits doctor on the next appointment. Doctor observes the side effect and does not take remedial action, this is last clear chance and permanent injury to the patient. Avoidable consequence rule. Similar to last clear chance doctrine, both the doctor and the patient are negligent. Okay, but here the patient has the last chance to avoid damage. Example, a diabetic patient comes to doctor with foot injury. The doctor does not prescribe antibiotics, doctor negligent, but advises him to keep the wound clean and keep blood sugar under control, instructs him for a follow-up after 1 week. The patient does not keep the wound clean and does not follow diabetic diet. Patient negligence, wound gets infected. Patient does not visit the doctor after 1 week, develops foot gangrene, avoidable consequence. Okay. So there are two scenarios, that is last clear chance doctrine and avoidable consequence. Composite negligence, also called percentage negligence. When the combined negligence of two or more doctors at the same time results in the damage to the patient, it is called composite negligence. So the patient visits for example, three doctors, and then what happens? The damage happens. So we'll be like checking. No, we'll be investigating each doctor separately to calculate composite negligence. Corporate negligence. When the patient care is affected by malfunctioning or equipment, incompetent staff, etc., of a corporate hospital. When the hospital fails in any manner to meet the accepted standards of care, which may result in the injury to the patient. Examples. Adverse effects caused due to an expired drug given during hospital stay. Prolonged hospital stay due to the incompetent hospital staff. Defense against negligence. No duty owed to the patient. If the doctor had not agreed to treat the patient, no doctor-patient relationship. So this is one of the defense when it comes to negligent cases. Okay. So the doctor says, I am not ready to treat the patient, but the patient came and got something, it's not clear. Okay, fine. Our aim is to get pass, to get good marks in exam. That's all. Duty discharged according to existing standards of medical practice. Calculated risk doctrine. Doctor took a reasonable and calculated risk when benefits overweigh risk to save the life of the patient, which in turn caused injury. Contributory negligence. The damage is due to intervention of a third person without the doctor's knowledge. The damage is an expected outcome of the disease, a known complication of the disease or treatment. Medical misadventure or inevitable accident. An accident or disaster in which an individual is injured or died due to some unintentional act by a doctor or hospital. Despite all proper care and precautions during treatment, the patient may suffer injuries. Therapeutic misadventure, hypersensitivity reaction or anaphylaxis with drugs like penicillin, aspirin, etc., occurring after negative test dose. Diagnostic misadventure, allergic reaction into contrast media given before a CT scan. Novus actus intervenience. Important. A completely unrelated, unexpected, unforeseen act has occurred with the further worsened condition caused by negligence of the doctor. Res judicata, double jeopardy. A matter already judged. Once a lawsuit is decided, the litigant parties are barred from raising the same issue again in the court. So we can't raise two cases at the same time. So that's what they are saying. Okay. Time limit. Cases should be filled within 2 years of the alleged date of negligence. Precautions of prevention of negligence. Establish good rapport with the patient. Maintain professional secrecy. Do not criticize another doctor in front of the patient. Keep professional knowledge updated. Apply due care and skill in treating a patient. Employ and associate with qualified and competent staff. Return consent in all steps if it involves risk. Take consent for both husband and wife if a treatment procedure may result in impotency or sterility. Laboratory investigation to confirm clinical diagnosis. Record patient conditions and treatment given regularly. Consult professional colleagues in whenever necessary. Always check intactness, instructions, date of expiry, etc. of an injection vial before use. Perform sensitivity test of a drug known to cause anaphylactic reactions. Always examine a female patient in the presence of another female or nurse. Issue medical certificate with caution. Do not make a statement admitting a fault on your part. Okay, bye. All the best.